Hello and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. And today I am so excited to have Dr. Joe Betancourt with us. Um, Dr. Betancourt is an internist by training and a graduate from the second class of the Commonwealth Fund Fellowship in Minority Health Policy. He is also currently serving as the Senior Vice President for Equity and Community Health at Mass General in Boston and is the rising president of the Commonwealth Fund. Congratulations on that new role. We're super excited to hear some about that today. How are you?
I'm doing great. This has been an incredible year. I just feel blessed. And I think the last point you mentioned about being the incoming president of the Commonwealth Fund is really special, especially for our conversation, because the fellowship has meant the world to me. It was my transformational experience, and to be able to come full circle now. I sent a note out to everybody saying this is our house now. It's really amazing. So thank you for having me.
Thank you so much. And so take us, I assume, I'm making a big assumption here, that when you graduated in 98, you didn't think you're going to be president of the Commonwealth Fund, right?
Sure
But
did.
but take us back a little bit even before that. Like what drew you to medicine? How did you end up in the fellowship? I mean, it was new, wasn't, we didn't have this 25-year history. So you took a chance on not a big chance. Joan Reed is still Joan Reed, but you took a chance on a new fellowship and kind of a new kind of academic space at the time. So tell us a little bit about the journey there
Yeah.
and we'll start there.
Happy to. Yeah. So, I think I always like to begin with my origin story, which is, my grandparents came from Puerto Rico in the late 1950s. My grandmother, two grandmothers, one worked in the sweatshops in Midtown Manhattan. The other one worked cleaning rooms at a YMCA. My grandfather opened up a bodega in Spanish Harlem. That is my origin story. These are people who were courageous, who took, incredible chances, who made great sacrifices, to give my family the opportunity to be where I am today. My parents, both came to New York when they were just a couple years old. I often say that the social determinants of health, social influences of health, structural racism are not things I read about in books. They're things that I experienced with my family. That was their experience as they grew up. My dad didn't graduate high school. My mom finished high school, but did a couple of associate's degree courses, but neither of them made it to higher education. And they really made it their work to sacrifice for their kids, to do everything they could so that we could have the opportunity to be safe, to value and really care about education, be focused, and to advance our lives. That was really what their lives were when they were in their 20s. And so it's due to all that. Those are the shoulders I stand on. That I grew up in New York City, and lived in New York City till I was 7. The funny part, kind of going forward a bit, is the hospital I was born in is exactly 30 blocks north of the Harkness House where the Commonwealth Fund is housed. So that is also, talk about coming full circle, is incredible. My parents taught me the importance of education. My dad was a community organizer of minority workers in the workspace. My mom always kind of was committed to vulnerable populations. So that was my genetic imprint. And, they gave me the ability to dream about being a doctor when I really didn't understand, a lot about what that path was, didn't have a lot of mentorship. But, for many of us, as people call it, the noble professions, or be a doctor, be a lawyer, right? That's what you do. That being said, that wasn't a stretch for me because I did really enjoy science, and I did, I was inquisitive, so it was a good fit. And so, moved to Puerto Rico, lived in Puerto Rico from the time I was 7 till 10, then came back and resettled in New Jersey and with access to New York. I went to 5 schools in my first 6 years, and then really settled in northern New Jersey, and then went to Maryland for undergrad, Rutgers in Newark for medical school, and then went to Cornell in New York for my internal medicine residency training. So that brings us to kind of the fellowship. So I would say that in medical school in Newark, primarily minority, underserved community, that's where I began to really, my genes started to, I think, started to flourish, started to come to life, in that I saw the value that I brought coming from my experience. I saw the fact that because I spoke Spanish, I was able to engage with other people. I saw how few people like me there were in medical school. And that's when I really started to say, could I ever create a career where this work, improving, back then we called it minority health, addressing minority health, diversity in the workforce, that term has stayed the same, community health. Could I ever do this as a lifetime pursuit, but not knowing the avenues? And so I went into internal medicine residency after having that kind of real deep discernment and transformational experience in my mind in Newark. And then in internal medicine residency at Cornell, where I did a lot of patient stuff, a lot of community stuff. So I was building up a lot of diversity stuff. I was building up my work in diversity, in community health, in minority health. And Mary, I'm thinking, okay, what am I going to do when I'm done? Is it health service researcher? I was thinking cardiologist, or do I become, I don't want to get into this minority health stuff. Is it do research? And like God said, I get this brochure, paper brochure of the Commonwealth Fund Fellowship Minority Health Policy at Harvard. And when I read it, it was like, it like came from above. I mean, the message of what the fellowship was going to do and what its goals were, it was another one of these transformational moments. So like, oh my God, this is it. That's how I got into, this is old school, right? The brochures, and by the grace of God, that brochure made it in some envelope to me. I was on some list, but that's how I got introduced to the fellowship. And I think for me, a kid who could even maybe dream about going to the Ivy Leagues. I mean, Cornell was the closest I came for residency. To think that I might be able to go to the Harvard School of Public Health and somebody would pay for it, and I would get leadership training in minority health and Joan Reed, all this stuff. I just prayed for so long that I would get in. I guess that's where I'll leave the answer to this long answer to a very basic question.
No, that was great. I really appreciate you sharing the journey. I think for so many of us, the lived experience really, influences what we do professionally, but especially in the world of health equity. My journey into the fellowship was something similar. I got a random email from one of my chiefs, and buried in the email, I was like, "This is what I, kind of like this is what I've been waiting for." So
Yes,
I
yes,
definitely,
yes.
um, am, relate to that sentiment about it being sent, and definitely being
Yep.
a transformational year that and you can't even really imagine how great it's going to be until you get into it, and
No,
then
and I didn't have a lot to base it on because
yeah.
I was the second class, right? I was exactly like there was one class, the first class, Fito Valadez, Anita Moncrief, and Yvette Rubidoux, and they were wonderful people. But we're basing it on the experience of three people. But it was like this is it, like it'll work out. But yeah,
and, and it worked out well.
it worked
um
out well.
So, in kind of telling us a little bit about, the landscape, then, even talking about, and we've talked about this a couple of times on the podcast, like even how the vocabulary has changed, right,
Yes,
over the
yeah,
course of the year, and how we describe, minority health, health disparities, health equity. There's lots of words in between, cultural competency and
yeah,
diversity, and like all of these words.
yeah.
But take us back a little bit to that landscape when you finished the fellowship, and getting into the space initially, in thinking a little bit about how you decided to create and innovate, right? And so now there are lots of creations of health equity officers and across corporations, but at that time that wasn't necessarily a role that you could go looking for, right? So can you talk about a little bit of now after the fellowship, and then how did you get to the Disparities Solution Center? Can you take us through
Yeah.
that part of the journey?
Yeah. So look, I mean, I think when I was in residency, clearly, and in medical school, there was a series of things. We always talked about the Heckler report, right?
Mhm.
And I did a lot of this studying on my own, right? So the kind of the seminal documents for me were the Heckler report. There was the NHANES, the National Hispanic Nutrition Examination Survey, which provided incredible information on Hispanic health, which I had an interest in given my background. And then in 1997, President Clinton did his initiative on race. And that was the first time where they said healthy people is no longer going to have two different targets for different populations. We're going to have one target for the population. And there was new energy, new resources in the federal government coming into this area of minority health. So, I think at that time, it was just an aspiration. The email I sent to the fellows talks about, something I said way back when was I wanted to run stuff. Like I didn't know what it was, but I knew that our people needed help. I knew that I wanted to help, and I knew that the best way to help was through the biggest perch. That's the best way to help the most people. But I didn't know what that meant, and there wasn't a lot of positions in this space. I mean, most of the minority health leaders, quite frankly, were either doing work in diversity, like Joan Reed, or were minority health researchers who you'd look up to because they were really setting the pace for this work. So, the fellowship was an incredible transformational year because it took this energy without a lot of direction, but passion, dedication, commitment, and began to shape me with a process for assessing opportunities, a process for being more professional, a process for understanding how to communicate, how to strategize, how to be political, how to leverage emotional intelligence, like all these key leadership activities, in addition to the Master's in Public Health that the fellowship provided, which is the formal education. And I think the biggest thing the fellowship provided was access to key leaders in minority health, who I leverage those relationships up until today. Incredible people who we met through the fellowship, who went on to do even bigger things, and who we were at kind of at an email, just an email away. And so coming out of the fellowship, I wanted to kind of leverage some of those things that I learned. And so the first thing I did was I went back to Cornell and formed the first Center for Minority Health and Health, Center for Minority, Multicultural and Minority Health was the term. And basically we had three things we were going to do: minority health and health policy research, diversity in the healthcare professions we're going to work on, and then cross-cultural education. So I did that for 2.5 years, and then I was in a relationship, and there were great opportunities at MGH for me to kind of build what I was doing. I was kind of, my lanes were closed, and that I was only going to be able to stay within the Department of Medicine at Cornell, but MGH was going to give me a broader platform. So I came up here in 2001 and started to do minority health and health policy research. Commonwealth Fund gave me my first couple of grants. So that was really amazing too. So that's kind of step two, part two of Commonwealth Fund's contribution to my career. But started to do that work. And then I got a lot more on the national scene. And I think the biggest pivot for me was getting on the Institute of Medicine committee that then ultimately ended up releasing Unequal Treatment, which was, totally due to the fellowship. It's 2 years out of residency on this IOM committee, kind of unheard of, but that was a big pivot. And so the Disparities Solution Center grew out of that to bring this to a close. And that I was sitting in a place that cared deeply about this work. We were doing work at MGH on disparities. The term had changed from minority health now to health disparities, beginning to go to equity. And at that time, through great mentorship, including Dr. David Blumenthal, who is now passing the baton to me. He brought me to MGH. He supported my career. He said, "Joe, you're doing great work. What's next?" And I said, "I want to give you a proposal." And I wrote a 10-page proposal for the Disparities Solution Center with the idea that there's a lot of people doing research. We need to create a movement nationally that advances this work from the standpoint of policy, practice, and operations in hospitals and health plans. And that's where the Disparities Solution Center was born, through about a $4 million commitment from Mass General Hospital and Partners Healthcare. And that launched my career again to dig into this work at a deeper level, and to have one foot at MGH, but also one foot externally doing work across the nation.
That's amazing. Thank you so much for sharing that part of the journey. I think it's, even still in that was several years ago, but we're still in that space where we feel like we still need to talk about it. Like we know the issues at this point. We need the solutions, we need the innovation,
Yes.
we need the policy changes and the practice changes. And so I think you clearly a little ahead of your time in that thought process. But I'm hoping we're moving toward that even more. But I do feel like, especially I guess in academics too, from where our backgrounds are, people want to research it some more. Like we don't need to research it anymore. We need to do it.
Yeah. Yeah.
People need their lives changed right now, so we need
Yes.
solutions. And so, the Commonwealth Fund, of course, is a recurrent theme in this conversation. And for those listening, So, our fellowship is called the Commonwealth Fund Fellowship for a reason because they are a major funder, but also we're part of the development process with Karen Davis and Dr. Reed when they were developing the program back in launched in '96. But tell us a little bit for those listening. What is the Commonwealth Fund? What is a
Yeah.
fund in general, and what is the Commonwealth Fund, and why is that so important to this conversation? And then a little bit on why is the Commonwealth Fund just so special? It's a little bit more
Yeah.
special than the others, right?
Yeah. Well, I mean, I think in my career, the Commonwealth Fund has been very supportive of me in a couple of different points that I mentioned. And I think after leading the Disparities Solution Center for a bunch of years, I was lucky in that MGH created a vice president position for equity and inclusion that I assumed in 2019. And then that grew to senior vice president for equity and community health, where here at MGH, I'm going to have a chance to oversee about 140 people, a portfolio of about $25 million in the areas of diversity, inclusion, equity, and community health. So, we really think about equity centered in the entire care journey from doorstep to hospital bedside and back. And this has been my dream job and an incredible, opportunity for me. And I've loved every single minute of it. But of course, this year, the Commonwealth Fund presidency becomes
All right.
open due to David Blumenthal's retirement. And I have the great honor of being considered and going through that process. And so for people, who don't know, philanthropy is a very important part of our landscape as a nation in general, and certainly in healthcare. And if you think about national healthcare foundations, the ones that tend to come to mind are the Robert Wood Johnson Foundation, the Commonwealth Fund, the Kaiser Family Foundation. Those are some of the big ones that focus particularly and almost exclusively in healthcare. And then you have very prominent foundations that I was involved with in years past, the California Endowment, California Healthcare Foundation, that are statewide. Kellogg has been another one that's done a lot of work in workforce diversity. So foundations really are often formed either through a couple of different ways, but the two common ones are conversion foundations, where if a large organization in California, for example, the Blues go from not-for-profit to for-profit, then they have to spin out resources to create a foundation, given that they benefited from not-for-profit status for many, many years. So that's there's that type of conversion foundation. There's corporate foundations. There's foundations that are part of private corporations that they spin off resources to provide philanthropy. And then there's family foundations, where somewhere along the line, some family has decided that they want to make a contribution to society in some way. That is the story of the Commonwealth Fund. So the Commonwealth Fund was started in 1918, and it's the Harkness family. So we, as Commonwealth Fund fellows, oftentimes heard about this. I've referenced the Harkness House.
Yes.
And basically, this is a house of the Harkness family where the Commonwealth Fund now sits. It is on 75th Street and 5th Avenue in Manhattan. And basically, this was a family, primarily through Anna Harkness, who, through a donation of $10 million to start this foundation, really said, we want to think about philanthropy as a way to improve the health and well-being of people in a variety of different ways. And what we call kind of a socially concerned philanthropy that would leverage, to the improvement of the well-being of particularly vulnerable populations. So that, the way these foundations worked, 1918, these resources grow. Some people add resources to it. The endowment has peaked at about $1.3 billion. And it ranges, obviously some of the endowment flows a bit with the stock market. And so it's come down a bit, but nevertheless, as a foundation, you have a commitment to commit X amount of your endowment to philanthropic efforts, right? That's the goal. So the Commonwealth Fund is not just a philanthropy that pushes money out. It is what they call a think and do tank. They have an internal research team that does a lot of, great policy reports, and they just did a great report with Yale on how many lives were saved and how many hospitalizations were saved as a result of the COVID vaccine. And they've done work on healthcare and access and coverage, and they've done a lot of work on equity and internally, but they also give out grants to have partnerships to do that research, and partnerships and grants for the Commonwealth Fund Fellowship in Minority Health Policy. So that is what philanthropy does. I'd say that it is nonpartisan. You do get to kind of meet with legislators at the federal and state side to really think about policies in this space. And so it is a position, I think, of fairly significant prominence in that you can really help shape the national dialogue. You could use research and science to shape, legislation and policy, and you could use philanthropy resources to actually grow programs, grow people, grow research. So that's what philanthropy is. That's what the Commonwealth Fund is, and so it's the honor of a lifetime, yet again, to be able to lead this venerable institution.
So amazing. Thank you for taking people through that. I know, we use the word a lot, but I don't know if people really understand the breadth of philanthropy and what and how it can be used. Is there something you're super excited about for next year as you start?
Yeah, I'm super excited. Look, I mean, I think here's the great news. The great news is I'm stepping into an organization that has an incredible history, that has an incredible team, that has a phenomenal board, that is coming off the heels of an incredible president with huge shoes that I can't even fill. All that being said, these are the challenges that I live for. These are the challenges I think many of us live for. The opportunity now to shepherd this incredible institution who's meant so much to me and to us as fellows into the future, and who's meant so much to this country, because clearly a lot of the Affordable Care Act, to be clear, came out of a lot of the research that the Commonwealth Fund supported and or did. I mean, the history of incredible success that the Commonwealth Fund has had in advancing the health and well-being of vulnerable communities and people through a variety of different ways is just incredible. So for me to be able to come in, leverage all of that, and think about what does the future look like? What ways do we take ourselves into the future? What are the ways in which we become even more impactful? What are the ways in which we do bigger and better things? Is just really incredibly exciting.
And so, we spent a lot of time thinking about and talking about all the wonderful things. But if you wouldn't mind, just spend a few minutes on talking about the balance, right? So this is hard work. It often comes, there have to be sacrifices that have to be made. And you alluded to some, to moving and family and adjusting. And we talked briefly before we got on about still trying to see patients, right? So, the reality is we have to do these big picture things, but at the end of the day, people still have to be taken care of on a daily basis. So,
yeah,
what is your advice for people who are new to the space, who are trying to juggle all that, find the balance, how, trying to figure out how to get through those hard days when it seems like, we're, banging our head against the wall because the needle's not moving.
Yeah, it's challenging. I mean, this has been a journey, right? I mean, I've learned to not sacrifice my values, but temper my expectations. And by that, I mean, I'm a person who lives every day with the urgency of now. But I think we need to understand that our biggest contribution is to move the needle in our time. But to not do it where we become martyrs or destroy ourselves or our families or our own well-being, we can't do that. And sometimes when you're so passionate about something, it all becomes a gray zone, right? You get the most fulfillment out of a success in your work. And then you turn around and be like, man, I haven't been out to listen to music in a long time, or I haven't been out and done this or done that. So you need to guard against that. Now, certainly there's certain times in your career where you will burn harder. And, it will be variable, but I would say some key ingredients for me is you have to find joy. I mean, you got to really be deliberate around finding joy, taking care of your mental health, your physical health, your emotional health, relationships, family. You don't want to leave that on the back burner because the truth of the matter is nobody in our lifetime is going to solve all the challenges that we're facing, but we've made progress. So I'd say that's the menu or recipe that I try to follow. And I've been better at it sometimes, worse at it in others. COVID took a lot out of me, and I lost a lot of hair and became a lot grayer during COVID, like all of us, but driving hard, because I think COVID was particularly sensitive because we knew every day we weren't making progress. People were dying, literally dying that day. A little bit different than chronic disease, where you say, okay. But I think that is my advice to people. My advice to people is, you do want to be strategic, thoughtful, benefit from mentorship, take your drive and energy, but it's about working not just hard, but working smart. And really striking that balance just makes you better in general. It makes you a more effective leader. And being genuine, transparent, having a high level of emotional intelligence, you know, kind of being relationship centered for me are what I consider my key leadership ingredients. And those are the kind of principles that I've attempted to follow, and leading with integrity. I think those are really important. So kind of a mix of those things has gotten me to I think, and on the shoulders of a million people. And I always stress that. People may get tired of me talking about that, but nothing that I've done was me doing it by myself. Nothing, you know, whether it be my family, mentors, supporters, you know, other people who've done this work, our family of fellows. I mean, none of this. So I'm just honored to be part of the conversation.
Indeed. And you know, coming into the fellowship and even afterwards, you know, one of the strengths of it is that building of community and network and learning how to do that amongst each other, but also as we go out into our everyday lives. And so those words were, I think, right on time and very poignant about trying to make sure that you're still accountable to yourself, right? You gotta be
No
able to do
doubt.
the work, so you gotta take care of yourself. Um, One of the other, and that probably be one of our last questions, but you know, some in this space right now, and I alluded to this earlier, with kind of this explosion of health equity officers and other titles along that line across corporations. And um, sometimes I get a little bit nervous on whether this is true momentum or false momentum, and it'll fizzle out. And kind of hearing some of the people who are taking those positions who are taking the position in name, but without, you know, resources or support of the rest of the leadership team. Do you have any thoughts on, you know, where do you sense this journey is going right now, and how people should, you know, figure out if when they're looking at these jobs, how to decide if they're real or not, for lack of a better word.
Yeah, you know, there's no doubt that 2020 catapulted this movement in ways that I really appreciated, and we all try to grab as much ground as possible,
Yeah.
and positions were created and the like. And to your point, I think many people responded with positions or, you know, launching activities that, if you really look under the hood, don't have the key factors for success, which is goals, key activities, timeline, milestone, accountability, resources, transparency, right? And so, you know, what I would encourage anybody who's considering a position like this is, you really want to go through, is there going to be accountability? Is there going to be resources? Is there a team? What are you aspiring to do? And this is not to say that when you get in a position, you can't make something of it. So I don't
Right.
want to, you
Right.
know, clearly people aren't going to just, you know, immediately maybe just build out everything. We do have to do the work to build it. But I do, you know, we are seeing, and we expected this. We expected to see this big boost and then a little bit of flaming out. I mean, in our history, we have these, they're this, and then kind of get back. You know, it's that's the type of evolution that we see, where we see big bursts of progress. You know, kind of you come back, not back to the mean, but you come back a little bit. And I think we're seeing a little bit of that. That is absolutely made much worse today in the hospital space,
Mhm.
due to, you know, the current significant financial crises that our hospitals are under, due to supply chain, workforce, COVID, throughput. You know, we have had to, I think, and the nation's hospitals have had to really curb their ambitions in mission oriented work, because, you know, for many of these places now, survival is the main goal, not you know, definitely not, you know, excelling, which is, we were all like ready to rockets and ready to rocket and launch. And I think the reality of this space has changed due to these bigger issues that we face.
Yeah. I mean, I think, to your point, I think we're still a lot to be hopeful for.
Yeah, no
Definitely in
doubt.
a different place than we were
No
a few
doubt.
years ago. So I hope the
Oh
momentum
yeah,
continues, and I'm looking forward to seeing where it goes.
as I am.
So as we close, you know, going back to a hopeful note,
Yep,
um,
yep.
you know, so we have, of course, a new bunch of fellows this year. What advice would you leave them with? You know, what are you looking forward to from the next generation who is, you know, coming along behind us, picking up the torch?
Yeah.
What would you
I,
leave them
I,
with?
I think the beauty is that, you know, with each fellowship year, there is a bigger family that each new fellow can count on. And if you look at the fellowship, this is Joan Reed's vision. It is a who's who of leaders of color in the country, and forget leaders of color, leaders in the country.
Yeah.
And I'd say as you're entering the fellowship, get that fellowship, get the most that you can out of it in all ways. Listen to what you're going to hear from Joan and the people she brings in and the entire experience. Leverage all of us who've gone through the fellowship. You are not alone. Like, you have a family like none other, and really taking stock of that and leveraging that will position you for great things, no matter where you go or what you want to do. And I think we collectively are looking to open the doors for these next each additional class of fellows that we have. And so I think it's exciting. I think I do want to end on a hopeful note. My whole life has been hope. I mean, my whole life has been glass half full. And so I am hopeful, but you also deal with the realities and you say, okay, this is the current scenario. How do I pivot? What does success look like? Success may look like now, sustain, maintain, may not be growth. It might be sustain, maintain, don't fall too far behind. Having that reality, but always remaining hopeful and positive, I think are also key ingredients that have driven my career. And I think we need to maintain that ethos going forward.
Definitely. That was perfect. Thank you so much, just for doing all the work that you've done, for continuing to be engaged with us, to give us something to know that we can aspire to. I mean, it's to your point, like, we keep building on each other, and to now, for your accomplishments, just open the more doors to know what we can do, and to keep being focused on the most vulnerable populations, and just trying to make the lives of people who look like us better. So I appreciate all of that. Congratulations again on this
Thank you.
amazing appointment. We look forward to the other part is that you got to take us with you, right? So we look forward to going on the journey with you. And I wish you the best of luck. And if for whatever reason you need me to do anything for you, definitely let me know.
I appreciate that. And thank you for doing this. I mean, this is your ability to lead the Reed Scholars, your ability to kind of shine a light on us. Your leadership is just so meaningful. And I really appreciate it personally. And I'll look forward to having all the fellows over at the Harkness House. I'm excited about it. I remember walking in there in 1997 and being like, wow. And to now walk in there and be like, wow, my office is in this building, and how I want to make it open to all of us so that we demystify it, so that we fully understand that we do belong here. We belong here. And I'm just thrilled to be able to represent that for us and for our future. So thank you.
Thank you. Thank you. I appreciate those kind words. And with that, I will let you go back to the busy life that I know that you
Yeah, it's all good. It's all good. Thank you.
Thank you for listening to Reed Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.